Eastern Circle Incorporation listeners, Eastern Circle is pleased to present Alcohol Awareness Month. April is known as Alcohol Awareness Month. We will be discussing alcohol consumption, its health impact, prevention, and management guidelines. Thank you for joining us. What is alcohol? Alcohol is a psychoactive substance found in drinks like beer, wine, and spirits. It affects the central nervous system, altering brain function and behavior. While often consumed socially, alcohol can lead to dependence, addiction, and serious health risk. Let us now discuss global alcohol consumption data, that is worldwide consumption of alcohol and the United States. This will be discussed at this time. Data indicates that beginning at age 15 years, the consumption of alcohol per person annually is 5.5 liters at age 15. That is approximately 498 drinks annually from 2019 to 2024. Alcohol-related deaths globally, over 3 million deaths from 2019 to 2024. That's 1 in 11 deaths. That's 1 in 11 persons that you know, I know, that would have died from alcohol consumption or deaths related to alcohol consumption. In the United States, data indicates that over 178,000 deaths annually from alcohol consumption. Binge drinking is defined as 5 drinks or more for men within 2 hours. For women, 4 drinks or more within 2 hours. The economic costs of alcohol consumption globally, billions are spent on alcohol-related diseases and accidents. WHO recommendations are to reduce alcohol intake to prevent health issues. That is the reduction of alcohol intake to prevent health issues. Let's now talk about population breakdown and alcohol usage patterns. Adolescence, early exposure can impair brain development. Young adults, 18 years to 25 years, binge drinking is common. Adults, 26 years to 64 years, risk of chronic use and dependency from alcohol consumption. Older adults, 65 years and older, alcohol may interact with medications and increase risk of falls. Signs and symptoms of alcohol abuse. Early signs, you get increased tolerance to alcohol, drinking to relax, hiding alcohol use. That's early signs of abuse. Physical signs, slurred speech, impaired coordination, nausea. Behavioral symptoms or signs, neglecting responsibilities, mood swings, blackouts. Severe signs, withdrawal symptoms, shaking, sweating, seizures, and these are very detrimental. You can die from these severe signs. So seek help right away. If you have those symptoms or you know of any family or friends with those symptoms. Next, we'll be discussing complications of alcohol use. Complications such as liver disease, fatty liver, hepatitis, cirrhosis. Cirrhosis is when the alcohol does so much damage to the cells of the liver that they become scarred and they no longer function, and you get the yellowing of skin and you get swelling to your body. Swellings in the abdomen, swelling in the lower extremities, such as legs and feet, ankles. Heart disease, high blood pressure, stroke, heart failure. The brain, complications, memory loss, poor decision making, depression, and anxiety. Stomach complications from alcohol use, ulcers, stomach ulcers, acid reflux, internal bleeding. Higher rates of cancer are part of complications of alcohol use, and these are cancer of the breast, liver, and colon. Alcohol abuse can lead to intentional harm. That is like drunk driving with intent to harm or evade law enforcement, car accidents, driving under the influence of alcohol lead to fatalities, injuries, legal consequences, alcohol-related assaults, domestic abuse, risky sexual behavior with awareness of potential consequences, using alcohol as a tool for manipulation, self-harm, or suicidal attempts under the influence of alcohol. So these are some of the intentional harm from alcohol use. Let's now talk about unintentional harm from alcohol abuse. You would see some similarities with intentional harm from alcohol abuse. Accidental injuries, example, falls and workplace injuries due to impaired coordination or burns. Car accidents, again, driving under the influence of alcohol can lead to fatalities, injuries. Unplanned sexual activities or unprotected sex. Alcohol poisoning from excessive drinking. Unintentional property damage. Neglect of responsibility leading to job or work absenteeism, accidental academical failure, and family breakdowns. Also lead to low birth weight, learning disabilities, growth delays from unintentional harm from alcohol. These are some of the harms that can occur. Increased risk of miscarriages, or increased risk of miscarriage and stillbirth from alcohol abuse. Alcohol abuse impact on families and communities leads to emotional stress and breakdown of relationships, domestic violence and child neglect, financial burden, increased crime and unintentional injuries. Community outreach is needed for support and education. How do you manage alcohol consumption? Recommendations are men up to 2 drinks per day. Example, 24 ounces of beer, 10 ounces of wine, 3 ounces of liquor. For women, up to 1 drink per day. Example, 12 ounces of beer, 5 ounces of wine, 1.5 ounces of liquor. As you can see, the recommendation for women is half the amount that is recommended for men. How else you could manage your alcohol consumption? You could purchase a device or download a drink counting app, and this helps to track your consumption of alcohol. Strategies to cut back: choose low alcohol content, or highly recommended, alternating drinks with water. So if you have one beer, next drink could be water. If you drink 10 ounces of wine, next drink water. And this is the daily and weekly recommended limits for men, women. Let's now discuss guidelines for safe consumption of alcohol. Mild intake: men, less than 24 ounces of beer per day; women, less than 12 ounces of beer per day. Moderate intake: men, 24 to 40 ounces of beer per day; women, 12 to 20 ounces of beer per day. Heavy intake: men, greater than 40 ounces of beer per day; women, greater than 20 ounces of beer per day. The effects of the amount of alcohol intake, it affects the body functions differently. Mild intake would affect the body functions, the different organ functions differently compared to heavy intake of alcohol consumption. There are gender differences in alcohol effects. For women absorb alcohol faster, leading to quicker intoxication. You have a higher risk of liver and brain damage in women. Increased risk of breast cancer from alcohol consumption in women. For men, they are more prone to alcohol-related injuries and risky behaviors. Where can you seek help? Help are available through rehab centers, detox programs, therapy such as cognitive behavioral therapy, known as CBT, group counseling, medication-assisted treatments, naltrexone or disulfiram, and these must be prescribed. So you have to be under the care of a doctor, nurse practitioner, psychiatrist, psychologist. Support groups are available, such as Alcoholics Anonymous and Smart Recovery. Also highly recommended for management and recovery of alcohol abuse, a high level of alcohol consumption, lifestyle changes such as exercise, healthy diet, and supportive social circles. If you have friends that you can depend on, your family members, your community leaders, your pastors, you can seek help through that social circles. This is our references that we have obtained the data to discuss alcohol awareness and consumption of alcohol intake. Thank you again for tuning in. See you next month.